Welcome back to the Chatty Vets pod. I'm Brendan.
And I'm Charlotte. Thank you for tuning in.
Welcome to our first podcast of May, our 2-week Takedown episode.
So this is where we aim to bring you up to date with all the latest news and products in the UK from the last few weeks.
Well, this is the case normally, but today we've got something extra special in store for you.
Yeah, we do. So it's May, so it's officially Veterinary Nursing Awareness Month. And to celebrate, we wanted to do an episode focused on our amazing vet nursing students and RVNs.
Yeah, well, everyone who works within the veterinary profession knows what an important and integral part nurses are to the practice team. But the poor problem is nobody in the public seems to have a clue. So this episode is all about celebrating RVNs, the reality of their work, their skill, and the future of the profession in terms of our nurses.
We thought it was especially apt to have this episode now with the Veterinary Surgeons Act in the midst of a potential reform, which could finally, we really, really hope, lead to the protection of the RVN title and eventually allow RVNs more roles within veterinary work, which would be amazing.
And to help us chat through everything RVN related, we have 3 amazing special guests on the show, Jade, Elle and Alexandra.
Yeah, not just one. We got 3 for you today. We loved chatting to all of these amazing nurses and we wanted to focus on each of their individual strengths and passions within veterinary work. Rather than just one conversation, we wanted to bring you 3 perspectives that together show you just how diverse and powerful the RVN role really is.
So let's dive in. To start with, we chatted to the wonderful Jade, or Jade the vet nurse as she's known online, about how we can use our nurses to make the most of their incredible skill set, including Schedule 3 procedures, and how we should all be working as a team, from managers to vets and other members of the team, to get the best results for the practice.
Yeah, absolutely. Here she is now. Okay, so we have a lovely new guest on the podcast. Thank you very much to Jade for coming on board. Welcome.
Hello.
Hi, thank you for coming on with us today. So I think probably a few people that are listening maybe follow you on social media, but just for the people who don't, do you just want to tell us a little bit about yourself and what you do?
Yeah, sure. So my name's Jade and I'm a UK registered vet nurse. I'm also known as Jade the vet nurse. I do quite a lot of social media content, mostly on TikTok and Instagram. And then, I work full-time in practice as well. So I just pretty much am vet nurse by day and vet nurse by night.
We know you have quite a big social media presence, but what was your sort of aim for wanting to get into it? Was it to contact vet nurses or was it to contact the public about how to best nurse their animals? What did you get into it for, really?
It was more for the owner education aspect. And the main reason it actually happened, it's a bit of a sort of morbid, tragic story, but we had a situation at work where a couple rang up reception in absolute distress. Their dog was choking on a ball. They didn't know what to do, so obviously they were told, get it down. They were 5 minutes away. By the time they got it to us, it was too late, and I was just mortified. This was a really young golden retriever. I have a golden retriever. I remember just this situation thinking this could have been so different if only the owners had known first aid, if they'd have known what to do. And I just decided that week that I would try and make some videos to teach owners first aid. So things like CPR, what to do if your pet's choking. And I set it up last January, so 2025. And by December 2025, I'd grown it to over 200,000 followers. The first aid videos were the ones that got the most views, and it's incredible that I have potentially helped educate literally millions of pet owners on first aid. And I have actually received some private messages from people saying, I had this incident yesterday, my dog was choking on a ball. I thankfully seen and saved your video like a month ago, thinking I'd never need it. And they're like, I literally saved my dog's life with it yesterday, and I just wanted to message you and say thank you. God. And I'm just like, even if one of my videos had helped saved one animal, that would have been enough for me. But it grew the channel, and I just saw lots of opportunity to keep educating pet owners. So first aid, health and welfare. And then I just started, obviously I'm a vet nurse and my name on social media is Jade the vet nurse, but I still get a lot of people who refer to me, unfortunately, as vet. And I even get news media channels posting, sharing my videos, and it's, oh, vet says this. And I have to message them and I say, yeah, I'm not a vet. I'm a vet nurse, a qualified and registered veterinary nurse. This is its own profession, like this isn't fair. We deserve to be recognized. And it's true,
Yeah.
that I do feel quite strongly about that. And I don't know if
Yeah.
that's down to
Yeah.
the media companies being uneducated as to what vet nurses are and what we do, or whether they think maybe we're not worth as much as, it doesn't sound as dramatic or important as if it was coming from a vet. So either way, it's not great.
Yeah.
So I just try to promote what vet nurses do. And I've done that through my channel a lot as well, is I do a lot of, I try and do it like inspirational videos for vet nurses, occasional videos showing a lot about what we do, just as well to raise awareness of what we do, because I think,
Yeah.
again, not a lot of people understand our role. They have no idea what we do, or they still to this day think, we're just there to hold the animal while the vet does all the work.
I think that's part of the reason why we wanted to do this pod in particular, because we both feel really strongly that you guys are incredible. Your title should have been recognized a very long time ago. And I think maybe because a lot of the public don't see you guys as forward facing as they do vets, because there's not a lot of practices, unfortunately, don't have a lot of time to do loads of nurse consults. So
Mm,
the majority of the time when people come into a veterinary practice, they are seeing a vet,
mhm,
but we feel like you guys are massively underutilized. You have so many skills that
mm,
we should be, using you to your full potential, and the public should know exactly how much you guys can do because you're incredible. We can do your job. They're very different jobs.
yeah.
And I think people forget that. They think it's a ladder and it's 100% not. They're so different. What would you say in terms of recognition of vet nurses? What do you think we could be doing better as a profession to be pushing you guys forward and letting you get to the extent of your abilities, using all your skills?
I do think, obviously, giving us the recognition that we deserve, but also there is the ability for us to do these extra things. So, like, obviously, Schedule 3, clinics, and just working more sort of independently as a vet nurse, obviously always under direction of the vet. We're always a team, we work side by side. But I do think we aren't allowed to do as much as we probably could do. And I don't know why some vets are a little bit reluctant to let us do things. So I'll just, like, as an example, at my old practice, I was doing a lot of Schedule 3. I was pretty much suturing every day. I do lump removals. I was closing up all the bitch space. I was always scrubbed in, helping with the X-laps. I'd suture up at the end, and I was really, really confident with it. And I was looking to do my surgical nursing certificate. And then I ended up, changing practices, and I went somewhere completely different. And it was just like, no, no, nurses don't suture. And that was it. It was just an absolute no. But I'm qualified to do it. I have experience doing it. Under Schedule 3, I'm legally allowed to do it. And I think it can unlock so many benefits for the team, because
Yeah.
if you have got vet nurses doing stitch ups, lump removals, even when I would just go in and suture up the bitch space, sometimes that would save the vet 15, 20 minutes.
Mm,
That means they can go off and do something else in that time that only a vet can do.
mm,
But I don't know. I would absolutely love to suck up as much knowledge as possible and learn, because I
mm.
appreciate, obviously, everyone has different ways of doing things. So if you say to someone like, look, if you want the opportunity to do this, we'll do this together. You build up your
Yeah.
trust in your nurse, and then eventually you have enough trust in them that you're happy for them to do it solo. I do think as a profession, that might be helpful if vets, I think, were a bit more happy to work with their nurses to get them to a place where they can let them do things that, like, solo.
Do you
Yeah.
know where I
Yeah.
see it going wrong often is where vets have the intention to do it, but then they never do when it's quiet because they're like, oh no, we're okay. And then as soon as it goes crazy and everything goes nuts, they go, oh, can you do this? And then I think, like, you had a really good set where you're doing it every day. It's not about being a vet or a nurse. When you do it every day, you get good at it, don't I think? So I think it's more about just doing it regularly. But I think that
Yeah.
idea where we only surrender it when there's a million things going on and it's a panic and it's all crazy is just a silly way to do it. It's got to be part of the routine
Yeah.
day, hasn't it?
Yeah. Yeah. I
Yeah.
mean, I'd say, a year ago when I was doing surgery daily, I was very confident at doing it. If someone asked me right now, will you go and stitch something up? I'd probably be like, no. because I haven't done it in over a year now,
Yeah.
and at this point, I couldn't say I feel confident and I feel competent to do that. So if, at this moment in time, I would absolutely want to do it under direct supervision of a vet and be like, okay, do I remember? Am I doing it right? Because,
Yeah.
it's been what, 13 months since I have sutured anything. So
But that is, like you said,
Yeah.
really pointedly at the end, it's about relationships and trust, isn't it? And then once you develop it, but I suppose somewhere it needs to open up and then allow the relationship and trust to develop. And then
mm,
I find when, for example, you had that job of doing the stitching, if that's the only part of that procedure you're doing, you're gonna do it with all your heart and soul and do it really well. And
Yeah.
I generally find if you're using the team in different ways to do different things, I think that focuses each person on their task and they do it better, probably,
yeah,
the
and
overall.
that's something I say as well. Is I'd rather do the same thing sort of daily and be good at it than try and do a little bit of this and a little bit of that.
Yeah.
That's how I work. And I know not everyone works the same way. Some people don't like that sort of continuous repetitiveness, and they're
Yeah.
like, no, no, I need to be doing something different. But for me personally, I would prefer to just do the same thing, get good at it, know I'm good at it. And out of all of those stitch ups that I did, not one of them ever got infected. One of them never came undone. I took pictures of all of them because when I came to this
Eh,
new job as well, I was like trying to show pictures, and I'd be like, look, this is what I can do.
I'd say
Yeah.
the
Yeah.
other thing as a nurse, because 'cause you're more often doing the post-op checks, you've probably got a better idea how, like, you're getting that feedback
Yeah.
loop on the post-ops, which us vets don't usually get. So,
Yeah,
and you'll see, oh, when that end
Yeah.
knot's not tucked in properly or,
yeah,
whatever. When you're
yeah.
doing that suturing, you've in a way, you'll have probably seen more post-op issues than we may have, really.
Yeah, yeah, I
Yeah.
think that's a
So,
really good point, yeah.
I think it's just that mutual respect thing, isn't it? It's saying, okay, we can both do this. I think, Brendan, maybe we're a little bit more used to that working out of hours because I know that in day practice, everyone has their roles, right? You've got the vet that's on surgery, you've got the vet that's on consults, you've got the nurses that are on hospital, you've got the nurses that are on surgery, you've got the nurses that are doing consults, right? Everyone has their bit, a little bit where they are. Whereas
Mm,
when you do ECC, when you're sole charge and it's just two of you both muck in. So it's
yeah.
like you're both doing whatever you can to get by. And I mean, like vets are on their hands and knees scrubbing kennels. Sometimes, if people haven't had that experience, it's quite difficult to get out of your lane.
we just painted a picture there of like working as a team and doing this and that. Jade, you were saying about how the public just have no perception of what a nurse does. And that hasn't changed forever, I don't think. And I think TV and when vet practice is portrayed on TV, I don't think you see that working together. How often the nurse will say something as a vet, you think, oh, yeah, that's a good point, or I better do that. Or, you're handing over to the nurse to do the stitch up. You don't see that modeled for the public to see.
Yeah, in all of these kinds of programs, the vet is always the superhero, and that vets are, you're amazing, but it does put us in a huge shadow where I think a lot of the time people can't even see us. They don't have
Yeah.
any idea what we do. And funnily enough, a couple of weeks ago, I was on a bit of a rant at work, and I just went round pretty much all of my nursing colleagues, and I was just like, "Name a famous vet nurse," and they were just like, "Uh, uh, I don't know." And then I was like, "Okay," I was like, "Now name a famous female vet," and they were all like, and I was like, okay, now name a famous male vet. Noel Fitzpatrick, Rory the vet, Dr. Scott, I think, who does on This Morning. All men,
Yeah.
all wonderful. And I'm just like, for an industry that is so heavily
Yeah.
female dominated, it seems to be really heavily, what's the word, represented
Yeah.
by men.
Yeah.
And
Yeah.
you never see a vet nurse, like say on these TV programs. You never see a vet nurse giving out advice on This Morning, and it just does. Again, it sort of hides our abilities, and that's what I
Yeah.
really enjoy doing with my social media is being that voice and just being there and being like, this is my space and I deserve it. I worked hard for this qualification. I still work hard with all of my continuing professional development and I deserve to hold this space. And I think as long as you stay within your jurisdiction.
But it's like in practice, isn't it? It's like if we do a C-section, the vets
Yeah.
are the one that speaks to the owners, but you
Yeah.
guys save the puppies. We get them out, but then
Yeah.
we just stitch the bitch up. Like, we don't actually
Yeah.
do anything with the puppies because we're scrubbed. But people don't see that. Like, you guys are incredible. And I think people undervalue you so much. And it really bugs me because I mean, ask the nurses that used to be with me when I first qualified. But honestly, I'd be like, what do I do with this?
But when you're
Help.
experienced, it's the same thing, but it doesn't make great TV, does it? If you've got this collaborative team that are working together and the nurse has suddenly got 5 things out that you're going to need because she's 3 steps ahead of you, that's not TV, is it? TV's about hero.
I think the sort of real life version that goes on in practice, which is where we all communicate together and as a team discuss different, ideas that will basically benefit the patient in the best way. And I do actually sometimes think, and I've come across many different vets throughout my journey, and I have met some that are just embrace nurses and come to us and are just like, what do you think? What do you suggest? And to be honest, I've worked at a practice, one of the first practices I worked at, it was very much, the vets were vets and they made the decisions and I just did my job and I did what I was told. And then having since gone to other practices where you have this sort of more, just where vets communicate with you and what genuinely want to know your
Collaboration.
ideas and opinions. I remember like one of the first times the vet being like, what do you think? And I was like, me? I was like, what are you asking me? Like, I've never been asked before. And now it's normal. And it's so nice to
Yeah.
be involved in that decision making, because I think obviously vet nurses just do bring so much, especially for patient care, that it's so important, and when you were saying about the puppies and you're just like, oh, it's the nurses that save the puppies, but it's just like, we wouldn't be able to save the puppies if you hadn't have done the surgery. It's that real,
Yeah.
team effort, and that is what makes all vets and vet nurses incredible. And I think that is the key to having a successful practice.
What do you think goes well within a nursing team? What doesn't go well within a nursing team?
If you've got that well-structured team, and this is something that I am so fortunate about where I work, is it is very, very well managed, very well structured. We are very well staffed, and I'm ever so grateful for that. That in the 13 months that I've been there, I think don't even think there's been a single day where I haven't had a lunch break. But that's something else that does seem to be the norm, I think, for both vets and vet nurses, is to not respect their boundaries. And a lunch break is it's a legal requirement. You are entitled to that lunch break and you should be allowed it. And I think there are a lot of vet nurses out there as well who have almost accepted that it's part of the role to not
Yeah.
be allowed that uninterrupted lunch break. And yeah, of course, the health and welfare always comes first. And obviously, if there was an animal in dire need, absolutely, we'd all get up off our lunch breaks and go. But when you're on your lunch break and you've got someone coming in going, oh, I've got someone on the phone, they want some flea and wormer, and you're like, no, it's not. I think we need to set
Yeah.
those boundaries.
You were saying, Jade, before about how some vets are different to others, where they're more like asking different everyone's like viewpoints, and you're getting the knowledge from the whole team.
I've worked in other practices where we weren't asked our opinions, and even if you tried to suggest something, it was just pish posh, like, no, we don't do it like that because that's just not how we do it, or we've always done it like this, or no, I'm the vet, I make that decision. It really does wear you down. It wears you down and
Yeah.
down and down, and you just eventually just end up thinking, like, I don't know, it takes something away from you, really. And I think that's why when I then went to this new practice and they were so willing to incorporate me in decisions and discussions, and I was just really taken back by it. But it builds that sort of confidence in you, but a confidence as well that you don't have to work alone, that you're part of a team, that you can share out this responsibility and these decisions and collaboratively, come up with the best sort of care plans and things. And I genuinely think, 2 minds are better than one, 10 minds are better than two. The more people that can get involved with these kinds of things, they can all bring different opinions and ideas. Because, in my team as well, we've got a really, really fantastic team, a very sort of diverse team with vast knowledge. We've got nurses doing certificates in anesthesia, surgery, physiotherapy. We've got all kinds of different nurses, and they all can just bring something really different, all have different interests. We've got one with a really strong interest in nutrition, and it's just like, if all of them combined with the vets all have their input, it's fantastic. The patient care
Yeah.
just goes up. It can only get better compared to one person being like, no, 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 I make all the decisions and it's all on me. And
Yeah.
what a responsibility for that one person to hold as well, you know?
Mm.
Like,
Yeah.
share the load.
Exactly. I mean, Jade, we probably have quite a lot of vets and especially new grads and maybe even vet students listening, because I know that there's sort of population of those kind of people that listen to the podcast is definitely growing. If you could say from a nursing point of view, to anybody who's new to the profession or due to start, or maybe anyone that doesn't feel like they maybe utilize their nurses as much as they should do, what would you say is your best sort of tip or thing that you could say to someone to say, if you can do this, then you'll get on so much better. It will be more collaborative.
I think I've seen a few different versions of vets coming out of vet school. I have seen some new grads come out of vet school and just give off this sort of impression like they have to know everything from the get-go. Like they're now qualified and that's it. They have to make all the decisions. They have to know everything. They can't be seen to look like they don't know what they're talking about. They can't be seen to look like they're, stupid, which they're not. And it's the same for vet nurses as well. You're not the all-knowing just because you're qualified. No, that is just the very, very beginning of the journey. You never stop learning, and we always keep, advancing and just gaining that knowledge from your team, which your vet nurses probably will have a lot of experience. Be willing to, I think, learn from them. Don't try and see yourself as having to be the vet who is someone who's superior, but you are working side by side. And that I think you should be open to having discussions with the team, even down to kennel assistants. Sometimes I go and ask my kennel assistants questions and I'll be like, oh, how do I do this? Or have you got any suggestions, how we could do this? And even that, receptionists, they all come up with fantastic ideas because again, it's that team sort of aspect of it is just don't be afraid to ask for help. Some vet nurses are a little bit scary, but deep down, we're all lovely. We're all lovely. I just think don't put so much pressure on yourself. Whether you're a new grad vet or a new grad vet nurse, don't come out of it thinking that you need to be the all knowing and have all the answers from the get go because you're not going to have them. And if you try and pretend like you have them all, it's more likely going to end up in a patient suffering, which is what none of us want. So you're better off coming out and saying, I've not done this before, or, oh, I'm not 100% sure about this. Have you got any suggestions? And it then just builds that relationships with the team and it helps them understand your abilities. You get to learn and grow and it works fantastically. And even if your nurse says something and you don't 100% agree with it, it doesn't mean you have to do what they've suggested. You might say, well, I understand why you said that, but what about this? Or why wouldn't you do it like this? And then they might turn around and say, oh, well, we've tried it like this before and it didn't work for this reason. And just have faith in your team and let them guide you, and you'll get there. But try and not be the all knowing from the get go.
Yeah, I couldn't
Yeah.
have said it better.
I'm hoping there's going to be practices around the country that hear about Jade closing up bitch space and doing suturing every day that go, do you know what? I think we should try that. I hope
Mm,
that sets a good example.
I do hope it at least inspires some vet nurses to just have faith in themselves, to believe in themselves, to believe in their worth, to believe that they deserve to hold this space, to share their knowledge, whether it be with pet owners, with vets. We deserve to be here and we work really hard for our qualifications. And we deserve to be heard. Honestly, I just want vet nurses to feel the appreciation that they deserve. I want them to feel like they deserve the space, they deserve to be heard and recognized and appreciated. And yeah, just
you want them to
keep
be
going. Whether
empowered.
you're educating one person in your practice, whether you want to start up on social media, go for it. If there are any vet nurses out there who want to take to social media, because there are so many ways of being a vet nurse as well, whether you're in practice, whether you're a locum vet nurse, whether you're a mobile vet nurse, or you want to be a social media vet nurse. This might be a whole new thing. This is a fantastic way to reach out to pet owners and to educate people. This is a perfectly, I think, viable way of being a vet nurse on a huge scale. The
Yeah.
potentials are quite endless when you take to social media. So if you want to, give it a go, then my advice would be just go for it.
We loved chatting to Jade. She has so many good ideas for how we can fully utilize RVNs to the best of their abilities and how much this would improve the veterinary profession as a whole.
Yeah, totally. It made me just rethink about that we're not always using nurses every day in the ways we can do. Every now and then we'll get really busy and go crazy, and then we go, oh, can you do this? Can you do that? But really, it should be built in. And also, it got me
Yeah.
thinking we should be talking to our nurses, finding out where they want to take themselves, and then
Yeah,
developing and
100%.
nurturing their interest. Yeah.
Yeah, absolutely. We need to get more into that discussion. We get so much into how practice has always been and your routine that I think we forget to try and think about, okay, how can we actually be improving our standards now? How can we get nurses doing more and utilizing more of their skills? I think it's definitely a discussion a lot of practices should now be having. So hopefully if people have listened to that, then fingers crossed it might spark a few discussions in practice, which is great. And the other thing that we wanted to mention while we're here is for any nurses out there who are wanting to kind of step a little bit outside of the box of GP practice and do something a little bit different. We've also recently found out about BSAVA Pet Savers.
Yes, we have. They're fantastic. They're a branch of the BSAVA that not many people know about. They're a charitable organisation and they're funded by fundraising mainly. And the purpose is to provide veterinary professionals with research grants to allow us to get more evidence-based medicine for the profession and just get better clinical standards.
Yeah, it looks really, really good. And we actually had a chat to a few of the lovely ladies working within the Pet Savers team recently. They're a great bunch. They're really, really nice. So if you're interested in either raising some money for a really cool charity, or you're interested in running your own research project in practice, to do with anything within veterinary medicine, then have a look at their website. We've added the link into the show notes for you just in case you're interested.
Yeah, so moving on to the next part of the show, we've done a little bit about the clinical side of nursing, but being an RVN isn't just about clinical skills, it's also about confidence, identity, career progression. So we've chatted to Elle, otherwise known as the positive vet nurse, about RVNs as professionals, how RVNs can look after themselves, how they're getting on, and how we as a profession can look after our nurses a little bit better.
Yeah, here she is now. Okay, so we have another very special guest on the show. We wanted to say a massive welcome to Elle. Thank you very much for joining us. So, to those listening that might not know who you are, do you want to give us a bit of background as to who you are and what you do?
Yeah, I'm a registered veterinary nurse. I've been doing this now for about 10 years. I've been in first opinion, I've been in referral, and I'm currently working part-time at a vet practice in Nottinghamshire. And I've also got my own business as well, which I have had for a very long time, something that I've been building up for a while now, and it's called The Positive Vet Nurse. So that's where I do one-to-one coaching with vets and vet nurses as well. And I've also now created my own membership as well recently to help veterinary nurses with their mindset and to help build confidence when they are in clinic. So that's me as an all-rounder, I think, really.
Do you think there's different nurse personalities for the different roles, whether that's primary, referral, neuro, surgical? Are they very different? Different skills needed?
That's a very good question. When you put it like that, yeah. I mean, I always thought I'd be kind of just your typical, like, all rounder nurse that just kind of does consults, anaesthetics, things like that. But when I did go to referral, I mean, don't get me wrong, I can't stand orthopedics. Like, I just don't like being in for so long. It just doesn't really interest me. Like, and I think that's okay to say as a nurse or as like vets as well. You're allowed to not like certain aspects of the job. And for me, orthopedics is one of them. It terrifies me. In my first sort of job as a student, I used to get shoved on in orthopedics when I didn't even really know how to do anaesthetics properly. So they'll be like, pass me the thingy-majig. And I'd be like, I don't know what that is. And I'd just be sat there crying because I'm like, I don't know what to do first. So I think I had a bad start to orthopedics. So I have got better with my confidence and I will get on with it now. And like when I've done locuming, I've got on with orthopedics and it's been a lot smoother and nicer. But I just kind of gravitated towards neurology when I was in that referral. I think it was good that the neurologists that we had were very passionate and they absolutely love teaching. So, if you were to ask questions, I'd be like, yeah. So I like the enthusiasm. I go off people's energy quite often. So if there's a good teacher, I'll often learn quite well. I know people that have only ever worked in referral, and like they can't imagine ever going back into first opinion. Like it terrifies them having to do lots of consults or anything that's not kind of what they're doing. Or on the other hand, I've got people that I know that have only ever done first opinion, and the thought of going into referral is like a massive mindset block where they're going, "Oh my god, I can't do that."
Yeah.
Do you think that you're utilised more to your full ability in referral practice, or do you think it's more so in GP, or do you think it just depends on the clinic? Do you think it's just completely dependent on where you are?
Yeah, I think it is
Mm.
dependent because when I'd gone to the referral, suddenly nurses were the ones that place IVs. We more or less get the patients prepped, ready, and the surgeons just do their bit. We had some of the nurses that did like the local blocks as well. But then I've been to other first opinions where the nurses again they get to do everything. They get to do schedule threes. Like at the practice that I'm at the moment, if I wanted to learn how to stitch up properly, I mean I've not done it for years, but if I was to have another good go at it, I think my surgeons would be like, yeah,
Yeah.
absolutely, like come on, let's show you, let's give it a go. But I know that not a lot of places are like that. So I think it does depend. Like you said, with where you are, like where you're at, to when you can then get utilised for your skills. And I'm lucky at the practice that I'm at where collaboration is a massive thing between the vets and the vet nurses. Like we are a team and that's how I love it to be. But I know that I've been to so many places and unfortunately it's the opposite of that. And it's not very nice environment where if you were to say how you were feeling or you want to advocate for a patient and go, actually, my spiny senses, my gut feeling, which us nurses have really, deep down, we
Yeah.
have this gut feeling of, this isn't quite right. We feel like we're treading on eggshells and that we can't say anything when really I think that should be okay to say and we have that collaboration. Obviously not in like an arrogant way of you're doing this wrong, I think this, but there's a way of wording it where it could be like, can I can I tell you something? Can I tell you what my thoughts are? And then it's kind of like accept, and if it's not right, it's not right, and that's okay. But to be heard, I think is something that we don't do enough is listen to each other and
Going on from that, when you're talking about sort of a nice environment to work in, self-confidence in nurses, etc., that sort of feeds a lot into what you do outside of clinic, doesn't it? So do you want to tell us a little bit about your business and what you do to try and empower nurses and help them along the way?
yeah. So the positive vet nurse, basically, I started that 8 years ago. So I was in my last year at uni. I was struggling quite a lot with my mental health around that time anyway. And I thought, you know what? I'm going to call it my positive vet nurse blog, right? And it's just going to be me talking about my own experiences, like sharing positive quotes, just things like that, really. And the idea of that was that I didn't want people to feel alone in it because I knew that mental health and the stigma in veterinary is huge, and especially at that time as well. I mean, things have started to change actually now, where there's more initiatives and stuff, but at the time there really wasn't anything. And I remember being in practice and someone was like, "Oh, you can't talk about stuff like that," and I was like, "We should be talking about stuff like that actually." So that really got me going with the positive vet nurse, and I said, if I can help at least one person, I've done my job. And I was talking about this the other day and I got really emotional with it because this is my like baby that I've created for myself. And today we hit 14,000
Wow. Wow.
on Instagram. And I was just like, if you had like an auditorium of that many people in a room, and I'm talking to people about how my journey has been. And I just kind of wanted it to be, I don't want people to feel like they're on their own with it because I felt like I was on my own with it. And I thought, I must be an awful vet nurse. I must be rubbish. Like I can't do anything right. And it's the fact that there's so many other people that are feeling that way, but they've got no safe space for it. There's nowhere to put that. Do you know what I mean? Whereas I have people that message me daily and are like, "Oh, can I just speak to you about something?" And it's that kind of for me, I love being that like person that they can come to and speak to about it and I can give advice. Like, yeah, sometimes I have to signpost, but I think that's better than somebody sitting in complete silence. And we know what mental health can do. We know the severity of what that can cause in our profession. And yeah, I just don't want people to feel that way. So then from there, the ideas kept going and going and going to then where I was like, oh, okay, I want to do something a bit different. So I started my coaching qualification. I got that, started my own business. At first, originally, it wasn't to do with a positive vet nurse. It was coaching, but I wanted to do it like for all women, and just kind of niche out of veterinary a little bit because I felt quite burnt out at the time. And I was like, I don't know how long I'm going to be in veterinary for, which is really sad to think, actually. I was like, I don't think I can do this anymore. And then what really happened was that nurses kept coming to me. And I was like, I can't get away from any of you. Yeah. And then it just kind of sent a little light bulb, and I was like, I can't leave this. Like, I've got too much to say. Like, I've got too much that I want to help with and do. So basically now I do it where I do coaching for people that maybe don't have a lot of confidence, they've got a lot of self-doubt in practice. Maybe they're going through a really tough time and their self-esteem is really low to the floor, and they just need that kind of direction, that actionable step as what to do. And I'm very affordable. Like I have very affordable and accessible coaching. Whereas a lot of the time, if you want private therapy or anything like that, which I'm not knocking, by the way,
Yeah.
but if you do want that, you normally have to pay a lot of money, and you're probably going to be on a long waiting list as well. Whereas with me, it's I kind of assess people as to where they're at and where they want to go. If I can help you, if you need referring to therapy, then that is definitely something that they can do. But a lot of the time, they just need that actionable plan of what to do next. So yeah, it's been a big journey.
Do you think it's the pressure, or do you think it's the way that people are treated in practice that knocks that confidence? Or is it, is it pressure from the people that they're working with, or how the rapport is with their team? Or do you think it's just the caseload, or, difficult cases or something going wrong? What do you think it is that knocks that confidence in the first place? Or do you think it's different for everyone?
Yeah. Really good question. I think a bit of everything, if I'm being honest. And people deal with stress differently. But I think a lot of the time it can not be helpful when you've got people in practice that aren't
Mm.
supportive, if your management isn't supportive, and you're kind of dealing with everything on your own. And I think as well, it's good to distinguish between the two. So we've got like self-esteem and then we've got confidence. Your self-esteem is how you see yourself and your worth as a human being and what your value is. And then your confidence is your belief in your abilities. But often the two get really wired together, and I find a lot of nurses that are so hard on themselves because they're tying their worth to themselves. Their job is tied to that worth. So if they think, oh, I've made a mistake, I've done that wrong, that fear of failure comes in and it becomes so painful and so raw that it then goes to the self-esteem part where it's then lowering our self-esteem, which then means we don't have that proper self-worth, that trust in ourselves, and then it impacts our confidence. So then from there, you then go, well, I can't do anything right, then I can't do it. And, it's this massive dip of competency. Like, you probably are really, really competent. You know what you're doing, but it's just that your belief in yourself and your self-esteem has just dropped so significantly that you don't see yourself as somebody that can do amazing things and that you are capable and that you can keep growing. We've just got this awful culture that we have to get it right first time. Like, we can't make mistakes. You can't say this, And yeah, I think as well, nurses get this mentality of only being a nurse. And again, this comes with that whole collaboration that I was talking about earlier, is that we need to have that positive culture where we are heard and where our ideas can be put across safely, because it is all about psychological safety as well. And this generally helps with that resilience and that confidence building, is because they know they're in a safe space. They know that whatever they say, whatever they do, they are still going to be a part of that team and still going to be recognized for their efforts nonetheless.
It comes down to practice culture again, doesn't it? Having a environment, and that seems to be a big issue. Maybe that is one of the big issues for nurses. I don't know. Tell me if I'm wrong, but having a practice culture where it's open, that you can speak up, that you're being listened to, that everyone's getting involved, that we're making the full use of everyone. All these things seem to come up again and again. This one of the big issues that's going wrong in vet nursing, maybe, or in vet
Yeah.
practice, I should say.
In veterinary,
Yeah.
yeah, I think so.
Yeah.
It's this culture that, like I said, it's this perfectionism, it's this fear of failure that comes in and not allowing collaboration. And there was a book that I was reading called The Courage to Be Disliked. And there's basically like a theory, and I can't remember it off the top of my head, but it's basically instead of seeing people on this like vertical line of you're higher up, you're better than me, I'm down here because I'm only a nurse. If we started seeing it as a horizontal line where we see each other as equal, we see each other as the same, and that we all have these different skill sets, all these things that we can bring to the table, that culture would be, it would have a huge shift, I think personally, if we focused on a more horizontal front of seeing it like that. And at the end of the day, nurses, we just want to utilize our skills. We want to be recognized for our hard work, and then also have that supportive leadership behind us as well, because I think that in itself is really important as well. Again, the fair pay to reflect all of that would be nice, but yeah, we know what that's like, trying to wish for that.
Yeah, and it's ironic, isn't it? Because just at a time when there's so much pressure from the public that fees are so high, you feel like crying out loud, actually, the wages in our industry don't, that's such a kick in the teeth, isn't it? When I don't think the wages are particularly high compared to other careers.
Imagine that, all that in consideration, and then if you were at a practice where you aren't being valued for what you do, you're being told no all the time. No, you can't run your own clinics. No, we haven't got time for you to do this. No, you can't do that CPD that you really want to do. I have been told no before for wanting to do CPD. I don't know why it's so difficult. But, all of that tied in, and all we want to do, because we're not in it for the money, we know that. It's that we just want to do a good job and know that we're doing a good job. I think that is what makes the biggest difference. Because I have a really good example of this as well, if you don't mind me sharing it. But about this kind of collaboration and trusting your vet nurses to make decisions. I was once in practice and this vet brought down into prep this Labrador, and it had gone off its legs, more or less all of them. Like very, knuckled. Otherwise, very, very bright, quite happy, didn't seem painful. And the owners wanted to go for put to sleep because they didn't have the money to do an MRI and CT to see neurologically what has happened here. And the vet was like, "Yeah, we're going to have to get a catheter in." And I just went, "Oh, you don't mind me interjecting, do you, about something?" And they were like, "No, go for it." I thought, "Whew, okay, cool." And I said, "This looks like a typical case of ANNPE." And he went, "What's that? I've never heard of that." So I basically explained to him that it's when the nucleus, in the spinal cord, it pops out, hits that spinal cord, and because it's gone at such a high rate, it means then they've gone off the legs completely. And again, it's typical in Labradors, which this was a Labrador. And he was just like, "Oh, yeah, like we've got anal tone, we've got stuff like that. It's quite bright." And I said, "If I may, can we say cage rest, really good pain relief, and physio? Even if the owners can't afford the physio, can we show them, I can show them how to do physio at home? Because owners can do it. It's fine. It's not going to hurt them." And he was like, "You know what? That sounds about right." So he typed it in Google, because again, vets don't know everything either. Like there's always going to be something that we don't know. And he typed it in, he went, "Yeah, yeah, yeah, that like a tick box." He's going, "Yeah, that relates." He went, "Let me speak to the owner." And they were so relieved because that day, I like to say that we saved that dog. And 2 weeks later, it came in and it was more or less walking on all four limbs still.
Yeah.
And that
this
was
is
going to be put to sleep. That 5-year-old dog was going to be put to sleep.
I mean, that's amazing that happened and you have that success story. It's great, isn't it? Okay, so thank you so much, Elle, for coming on board today. We really, really, really enjoyed chatting to you, and we felt like we could have spoken for hours, but thank you so much.
No, thank you for having me. I really appreciate it. Thank you.
Thank you so much to Elle for chatting us through all things confidence and pastoral care for our vet nursing team and how we can support our nurses to get better in practice.
Yeah, our nurses have so many skills. They're such a massive asset to our profession. So we really need to know how to appreciate and to look after them a little bit better. We've Also recently come across another great company, which feels really apt to mention here as well, and we think you'd actually really quite like to know about. There's a company called Veterinary Woman. It's a UK organisation fueled by a passion project of a fellow female veterinary professional, and it's all about female empowerment within the veterinary industry, about well-being, career development, and generally supporting women within the veterinary industry.
Yeah, they seem to be really championing change for a fairer, more equal working environment for women in practice. They've got loads of resources on their website, such as newsletters and events they carry out.
Yeah, so if you're interested in knowing a little bit more, again, the link is in the show notes for you.
Yeah, and on that topic, I don't know if you've talked with them about it, but there's so much about, because usually women that take a career break for mat leave and children, I think we could be doing so much better to help
Yeah.
particularly women get back into work after career breaks. So there is some big issues which I think have been a bit neglected.
Yeah, absolutely. But it's like when you go on holiday, right? You go away from general practice for what, 2, 3 weeks sometimes. You come back and you're like, oh my God, I've forgotten how to do everything. So
Yeah.
imagine don't get me wrong, I've not had kids, so I've not gone on mat leave and then had to go back. So I don't personally know what it's like, but I've had a lot of friends that have had that career break and come back, and it's terrifying coming back into practice after having that massive break. You know, your life has changed so much. You're more tired. You have so many other stresses. Your life is completely different. So I think there are so many more ways that we can try and better support women in those situations, because let's face it, the majority of people in the veterinary profession are women. So we probably need
Yeah.
to get a little bit better at supporting us. So, yeah.
Totally. I've seen some amazing nurses come back after even like 10, 15, 20 years. Honestly, even day one, all their handling and clinical skills are great. I think the tech
Yeah.
and the tech's going to be even bigger when that changes. That's what I think
Yeah.
one of the
Well, there's
hardest
just so
things.
many advances so quickly, aren't there? Like things change so much. So, yeah,
Yeah.
if ways that we can support them better would be really good to look into. So,
One area where we know RVNs have a huge impact, but that often gets overlooked, is the kind of niche expertise that they often have. Now, that can be expert knowledge in nutrition, behavior, weight management, physio, and there's even, obviously species specific expertise, whether exotics. So,
yeah, exactly. So, for this reason, we chatted to Alexandra recently about all things feline medicine. Now, Alexandra is a big part of the BVNA and iCatCare. So, we had a really, really interesting chat with her, covering everything from feline med, how we can better serve our purry patients in practice, to the vet surgeons reform, and how we can make positive change in our profession. We've got our third lovely guest on the show. So, very, very big welcome to Alex. Thank you very much for joining us.
It's great to be here. Thank you.
No worries. So, for anybody who might not know who you are, do you want to tell us a little bit about yourself, your time in clinical practice, what you're now doing, how your career has progressed?
Yeah, of course. I qualified as a veterinary nurse almost 30 years ago now. It'll be 30 years next year. So long time ago. I've spent most of my career, probably the last sort of 25 years, in first opinion, small animal practice. And then about 4 years ago, I joined International Cat Care as their cat wellbeing and behaviour advisor, which is like my dream job.
Wow.
I absolutely love it. And the
amazing.
reason I sort of ended up applying for that job was because many years beforehand, really getting into feline nursing and trying to understand cats a bit better, because I felt like they were really misunderstood as a species, both in practice and just sort of generally by the public as well. So I did start up a social media page to try and educate people about cats, which I don't run anymore, but I kind of learned a lot about cats and cat behaviour and cat wellbeing through doing the iCatCare nursing courses. And it just really motivated me to try and sort of teach others about it. And so when the role came up at iCatCare, I went for it, and I was really lucky that I got that job, and it is literally my dream job. I absolutely love it.
Good. So what is it that you do day to day now? Are you sort of working on educating public or vet professionals, or a mixture of both? Or
Yeah. So my role at iCatCare is part-time. What it tends to be is very much about educating others to help them help cats, if you like, or care for cats as best they can, regardless of what caregiver role they might be in. So they might be an owner, they might be working in a homing centre, they could be a veterinary professional. But we try and use sort of evidence-based information to help others to care for cats as best they can. So my role is quite diverse, actually. So one day I might be writing content for a course, and we've got quite a few nursing courses, and we've got a cat behavioural health program, which we've almost finished writing, which is really exciting. Or another day, I might be writing a blog. I recently wrote a blog about recognising signs of pain in cats. Or another day, I might be teaching. So I might be going to a conference and teaching. So it's quite a diverse role. It's very interesting. As well as that, I do sort of self-employed work as well. So similar sort of stuff I teach others about cat wellbeing. So yeah, a bit of a mix.
I know that you say you're not in clinical practice anymore, but I know that you didn't leave that long ago. Do you think that the way that we deal with our feline patients in practice, do you think that has got a lot better? And do you think there's still a hell of a long way to go?
I think a bit of both, really. I think in the last, I think it's 12 or 13 years since the Cat Friendly Clinic program came into play, and people have enrolled onto that and have learnt about cats and have learnt how to make sure that we meet their needs in a environment like the veterinary clinic, which is a really scary place for a cat. It's a really unfamiliar environment. There's lots of weird sort of sights and sounds and smells and things that cats just aren't used to. And of course, they're such territorial animals. I always say to people that cats are more attached to places than people, which probably sounds a bit harsh, but it is true to a certain degree. So I think we've come a long way in thinking about them as a species and how different they are from dogs and us as well. You know, they're not obligate social animals, but they do have species-specific needs. They need to feel safe. They need to feel in control. And if they don't, that's when things can go wrong for us when we're trying to care for them. So but I think we are much better than where we were at 10, 15 years ago. But there's still things I think we can do. But I appreciate it's tough if you're in a busy practice. Sometimes time can make things difficult, can't they, for us to want to do the best for our patients, even though we want that.
Yeah. And it's having the space as well. You know, not a lot of clinics are big enough to be able to have like cat only areas, sort of like cat only waiting rooms or consult rooms. I'd hope most places have a cat ward now, but not everywhere does. You know, if you've only got one kennel room and you're having to put them somewhere, it's not ideal, is it? If you've got like a yappy barking dog 2 kennels away.
But I would say, and I feel quite strongly about this because I think I sort of almost fell into this mindset for a while, is there's always something you can do. It doesn't matter what practice you're in. Sometimes, like you say, the building can't be changed because that's the physical environment. That's just what it is. But there's always something you can do to help the cats at your clinic. You know, if you can't have a separate cat ward, it might be that you make sure all cats have got somewhere to hide in their accommodation, and you might put sort of half a towel over the front of the kennel so they're not staring at other animals. You know, you can control the way you interact with cats as well. So I think there's always something you can do. And I would never want, especially vet nurses, I think we're quite tough on ourselves and we think I have to do everything that I should do to be a cat-friendly nurse, that, you know, and if I can't, then that makes me not a good veterinary nurse. And actually, that's not true. I think just do what you can in the environment that you're in.
Along those sort of lines, what do you think, regardless of where you're working, that we can all be doing in general practice to really help our feline patients? Do you think there is like a standard set of things that we can all be doing to help them generally when we do see them in practice?
Yeah, I think there's a few things. I think the environment is just as important as how we interact with people, with cats, sorry. So just thinking ahead about what you can do to make that environment cat friendly. And that's not just necessarily the veterinary environment. It's actually before they even arrive at the clinic. You know, what information can you give to an owner that's going to make traveling to the clinic easier for them and less stressful for the cat? And one thing I always say when I'm teaching about, because I talk about cat carrier training and people are like, oh my God, I can't do that. It's too difficult. It's actually not that difficult to train a cat to use their carrier. We've got some really good videos on the iCatCare YouTube channel, actually, about how to do that. But the first step of that is just making that cat carrier a nice, safe place for that cat to hide and rest at home. So instead of just getting it out when something not very nice is going to happen, getting it out the loft or the shed, and it smells funny and isn't, cat's like, I'm not going to go near that.
Yeah.
Making it a nice place for the cat to rest, you know, and then it's not such a scary thing. And even if people can just do that, that's really helpful because, of course, if the cat's really stressed and has a really bad time whilst they're en route to the clinic, by the time we see them in a consult, it's not a very happy cat. And then we can't do what we need to do. So I think that's really important. And also not rushing around cats. And I know that can be so hard when you're really busy and you're behind. This is where it comes to using the nursing team as well for vets. Make sure you utilise your nurses for your cat cases because I've seen it work quite well where you've got the vet does the consult, speaks to the owner, does examines the cat, but anything else, bloods or blood pressure, whatever it is, that then gets passed to the nursing team to do. And that can work quite well at just sort of helping to, I don't know, reduce stress in us so that we're not rushing, because cats will pick up if we're flustered and sort of rushing around. So yeah, don't rush. And then I suppose the last thing I would say, this might be a little bit controversial, is just, I know we like to use anxiolytic medication with cats now. And I think it's amazing that we can do that, and it's really helpful, but it's not a replacement for having a cat-friendly environment and making sure that you interact with cats in a gentle and respectful way.
Yeah.
So I think people need to sort of bear that in mind, because we don't, even though it's helpful to dispense or prescribe, gabapentin or pregabalin, whatever it is we're using, I don't think it's necessarily a replacement for
Yeah,
being cat-friendly.
absolutely. Yeah,
Yeah.
absolutely. So I know obviously we're talking a lot about what we can do in practice to help our feline patients.
Yes.
But we're chatting a lot in this episode about our nurses and how we can support you guys and what happens with your career. And correct me if I'm wrong, but I think a lot of nurses go into the profession, like it, don't like it, however it goes, but then feel like at one point they get to a bit of almost like a bit of a dead end where they're not sure where to go
Yeah, hit
next.
a ceiling.
Yeah, it's almost like it's where you either become head nurse or you stay doing what you're doing, and you might move somewhere different and maybe you'll do a certificate, but in theory, your day-to-day role doesn't necessarily change that much. And I know obviously you've now left general practice and have gone on to sort of a way that you can use your nursing role differently. So, I mean, what would you suggest if you were going to speak to other vet nurses that are out there? How do you think they can potentially diversify their careers, and why did you do it? Does that make sense?
Yeah, it does make sense. And I think you're right. I think sometimes nurses, certainly when I was in practice, sort of in the early years, it was very much like you got up to head nurse and then that was it. Like you didn't really have, and you didn't get any leadership training either.
Mm.
So you didn't really know what you were doing. I know certainly when I was head nurse, I hadn't done any leadership. There's so much more out there now. But yeah, I think I would always say, like, I still identify as a veterinary nurse. I still feel very strongly that that's a part of my identity and who I am. I just do it I still help animals, but in a different way. But yeah, I think people nurses need to go out and have a look and talk to other people that have done it, because there's so many different roles. It's not just, I mean, my role's quite educational. I know other people that work as sort of reps for companies that make, I don't know, they do a lot of wound management and dressings, but they're really passionate about wound management and they teach about it as well. Other people that run their own CPD, and run their own kind of events. Lots of people in different leadership skills. Quite a lot of nurses I know have now gone on to do much higher education. There's a few that have done PhDs as well, which
Wow.
just like makes me so happy. Like it makes
Yeah.
me really proud that they've done that. It's just, I think this is why it's good to go to some of these sort of conferences and events, BVNA Congress, London Vet Show, all these kind of things, because you can network and you can talk to people that have done other things and have diversified. I think for me, my story is that I realised cats are very misunderstood. I wanted to help cats. So it's like once you see it, you can't unsee it. And I wanted to be able to help others to understand that. I just kind of, that was my thing. And I know people say, oh, you have to find your niche and have a niche. But I actually would challenge that a little bit. I don't think you have to have a niche. You just need to find something that you enjoy. Then try and pursue that. And it doesn't have to be in clinical practice. There's lots of different ways you can do that.
Yeah, because like you say, you don't necessarily have to branch out. There are a lot of nurses out there that will
No.
love their GP role and they'll be
Yeah,
incredible at their
absolutely.
GP role. Or there might be some
Yeah,
nurses that decide they only want to do consults. They love nurse clinics and that's all they want to do. Or they just want to do surgical nursing, in which case they might go to referral to just be a surgical scrub
yeah,
nurse or whatever it might be. So there are ways you can branch out within practice. But I think people tend to forget about a lot of the other jobs that there are out there
yeah.
outside of clinical work, because there are a lot of them, nutrition companies, wherever, insurance companies, there's all those sort of places that will always want that nurse input.
There
So
are, and there's a lot more nurses in leadership roles now as well, which makes me happy. I think you need to have a nurse's perspective on a lot of things, not just in clinical practice but outside of practice as well. And I can just thinking of two of my friends actually that have also been on BVNA Council and been BVNA president, and they're both in leadership. One of them is a clinical director, which is
wow.
quite unusual for veterinary nurses. Yeah, she's amazing, Lindsay Hughes, and the other one is also in a leadership role, and they're just both amazing veterinary nurses, but they just do they don't work on the clinical side of it anymore. They do something else.
Mm.
And I think it's okay to change your mind as well if you think, oh, well, I've always thought I'd be, I don't know, a surgical nurse and want to be in theatre, but actually now I want to teach, or, now I want to do work in a charity role somewhere. I want to do something completely different. It's okay to do that.
Yeah, yeah. And do you think it took you a lot of confidence to sort of make that jump? Because I know a lot of nurses struggle with that confidence and feeling like, oh, well, I'm just a nurse, or you hear that phrase
Yeah,
coming along across quite a lot, don't you? So do you think it took
yeah.
you quite a lot to sort of step outside of that comfort zone? What would you say to nurses that are maybe considering it?
I think just go for it. Like you're only going to, what's the worst that's going to happen? You're going to go for a job and you won't get it. That's the worst thing that's going to happen. Or it might be that, I've been for interviews that have gone really well, and I've been to others where they haven't gone really well and I haven't got a job, but that's just life, isn't it? But you're
Yeah.
never going to know until you try. And if it is for a specific subject or something that you're really passionate about, then obviously, you need to know your stuff to be able to do that. But there's so many knowledgeable nurses out there, and just not being in clinical practice does not mean that you're not a veterinary nurse anymore. You are still a veterinary nurse. You're just doing things a bit differently.
Yeah.
Veterinary nurses need other veterinary nurses to teach them, guide them, be a role model, all that kind of stuff. So yeah, I just say go for it. I don't know if it's just because I'm quite old now. I kind of got to the point where I just was like, yeah, didn't have imposter syndrome.
Yeah.
So maybe it comes with experience, but I think just go for it. You've got nothing to lose. That's what I'd say.
Yeah, absolutely.
Going back to what we were talking about, vet nurses and vets have different perspectives, different roles. So at some point that there in the past, I hope that goes like a hierarchy, that there was vets and vet or people might feel that there's a hierarchy, and there shouldn't be,
No.
because aren't we losing a huge perspective? Like if we're looking at the same case from different points of view, shouldn't we be getting just as many vet nurses doing a PhD in management in all these roles as vets?
Yeah.
Because now we've got the different perspectives feeding in.
Yeah.
It's mad to ever think that there should ever have been some kind of weird hierarchy.
It is. I mean, I think
we're
it
doing
goes back
different
to-
jobs.
It's interprofessional working, isn't it? Really, is what we're talking about. And you said about perspective, and I think they're just two different roles. It's within that same profession, but we'll be classed as allied professionals as veterinary nurses, but they're different roles. The reception team is a different role. It's got different challenges. So is the nursing role. And I think the more perspectives you have, the better your patient outcome is going to be, right? So
Yeah.
it's good. The practices that I did do locum for a long time at one point, and I think what I saw worked really well was practices where they did rounds in the morning and the nurses were involved in that case discussion. And I just think the team worked better, the dynamic was better, it was healthier, there was a good culture, and the patients got better care because of that.
Mm.
So, it's important, isn't it?
Yeah, there's another that came into that with a GP, with how management responds to nurses. Because talking to the three nurses that we talked to, they've all got different passions and different areas they wanted to go into. But there's an element of the management having to be quite fleet-footed. If we want to get the best out of our nursing team, we should try and give them the opportunities,
Yeah.
like nurture them into giving them, like we had the nurse that wanted to do diabetic consults.
Mm.
And when you've got a nurse that's showing an interest in something, how can we use them to provide that service? That's obviously, it's massive value to the practice.
Some of it comes down to trust, doesn't it? And giving nurses autonomy to actually do these things. There is so much that we can do. You need to have these regular team meetings, don't you? And one-to-ones. That's important for the management team to do, to find out, okay, what are these nurses interested in doing? What can they bring to the table? And actually, there does need to be some responsibility to the veterinary nurses themselves to come forward with a plan if they want to do something specific, because, we don't like to talk about money, but at the end of the day, if you can come forward with a plan that's going to bring some money into the clinic, then that's going to get reinvested back into the clinic, and that's good for everyone, right? So you mentioned diabetic clinics, how would they work? What would we charge for them? I'm a massive advocate for charging for nurses' time. Don't think it should be
100%.
free,
No.
because we are skilled professionals. But I think if the nurses have a plan and actually have something prepped to talk to their management team or whoever their line manager is, then that's good, because that's showing initiative and it's showing that you're thinking about, okay, it's not just about me doing something I'm interested in, it's about me doing what's right for the patient, for the caregiver, but also for the clinic as well. I guess this is why the Veterinary Surgeons Act needs to be completely reformed, right?
Yeah.
It'll be nice if one day we have a nurse prescriber role.
Yeah.
Nurses
Yeah.
being more involved in anaesthesia or having that responsibility. Let's face it, nurses tend to do most of the anaesthesia in practice unless you're in a referral centre anyway. Yeah, there's so many things. And of course, protection of the title. You were talking about the public don't know who we are. And at the moment, they don't know what a registered vet nurse means. And we know that somebody could say, I'm a vet nurse and not be a vet nurse. So we need that title protected as well, because that will help. The public, this is why we do Veterinary Nurse Awareness Month, right? To let the public know this is what we do. Look at what we can do and look at how we can help you. So I realise I'm going off piece now.
No, it's good.
I am quite passionate
That's good.
about all this stuff, and it's hopefully going to change. I hope it changes in the next few years, because I'd love to see more nurses doing more roles and having more responsibility if that's what they want. Not everybody wants that, but I'm sure there are nurses out there that do.
Okay. I mean, is there anything else, Alex, that while you've got the platform that you want to have a chat about?
I think probably I'd say two things. I know I've mentioned BVNA a couple of times, and I didn't actually say in my bio that, but I did mention later that I was on BVNA Council. And I think BVNA needs nurses that are passionate and want to see change and actually want to commit to doing something for their profession and giving something back to their profession. I think they're looking for council members at the moment. So have a look at the BVNA website if that's something that you're interested in doing. It's very satisfying. It's quite hard work, but it's a good thing to do if you feel that you want to give something back to your profession. And I do think it's quite easy for people to sort of moan and say, oh, nothing ever changes. But you need to be that change.
Yeah.
If you want to see change. So that was the one thing. And then the other thing was just to say, if you're interested in doing any of the nursing courses or you want some good resources for owners, do have a look at the iCatCare website. It's just icatcare.org. There's loads and loads of resources on there for you to use, especially under the cat-friendly clinic part, if that's something that you're interested in as well. Yeah.
Perfect. Well, thank you so much, Alex, for coming on board with us today. We really, really enjoyed chatting to you and having you on the pod. So thank you very much.
Thank you. Thanks for having me.
Okay. Hopefully you enjoyed those interviews just as much as we did. We thought it was fabulous and we had a really good time chatting to the lovely ladies on the pod. So thank you so much for coming on board.
Yeah, thank you so much to Jade, Elle and Alexandra for taking the time to chat to us. We really enjoyed every discussion we had with you, and we're really hoping that you as listeners enjoyed it too.
Okay, so hopefully what you've heard today has sparked some really cool discussions. Fingers crossed you'll be chatting to members of your practice team and thinking about how we can better utilise our nurses. And hopefully it sort of made us think a little bit outside the box as to how we can make a really good change in the vet profession. But we really, really want to hear your feedback and your thoughts on this episode especially. So please do get in touch and let us know what you think. Send us your voice notes on WhatsApp or message us on social media. Or remember, you can start a discussion with us on our blog. We'd love to hear your feedback and comments. Are you an RVN or an SVN and have any comments or opinions on what we've discussed today? How can vets in practice better support our nurses? We want to hear from you.
Absolutely. Yeah, give us a day or two to reply sometimes, because nowadays we're getting 30 to 50 comments each week. So, yeah, and some of them are really kind of, they take us a bit of time to reply because we want to give them some thought. So, but yeah, get in touch. Tune in next Sunday for our next bonus episode. It's the first in our endocrinopathies series. So obviously all things hormonal diseases. Next week, we're going to do a clinical deep dive into hypo and hyperthyroidism, discussing how we can work up and manage these cases in general practice.
We're looking forward to it already. Until then, it's bye from me.
And bye from me. Take care. This podcast is intended for licensed veterinary professionals and is provided for educational and discussion purposes only. Whilst it is publicly accessible, it is not intended as advice for pet owners.
The views shared are based on our own clinical experience and interpretation and do not replace individual clinical judgment. We accept no responsibility for decisions made based on this content, and all cases should be assessed on an individual basis.
Any references to medications, treatments, or products are made for educational discussion only and are not intended to promote or advertise veterinary medicines to the general public. Veterinary medicine should only be used under the direction of a prescribing veterinary surgeon and in accordance with UK veterinary medicine regulations.
This podcast may include paid partnerships or sponsorships. These do not influence our clinical opinions, and any sponsored content will be clearly identified.